This is this is Airway Management. Before entering the room, or upon entering the room, I'm going to perform hand hygiene. I'm going to identify the patient using 2 markers. I'm going to explain the procedure. Alright, I've already got a towel laid down here. I'm going to place a waterproof pad over my patient's chest to catch any extra secretions. I'm going to perform hand hygiene. Alright, I'm going to open my suctioning kit. Open the flaps here to maintain a sterile field. I'm going to, the suctioning device is already on. I'm going to don my glove. It's not really in here per package. I'm going to don over my dominant hand. Alright, I'm going to take my little box here. I'm going to take my normal saline, pour it into the box. Okay, I'm going to don the other glove. Sterile, using sterile technique, and sterile touches sterile. Alright, I'm going to put on my protective PPE. I wouldn't wear these earrings there. Going to put on my mask, or my eyewear actually, and my mask. I'm going to open my catheter. I'm going to hold it in my non-dominant hand. I'm going to connect it to the suctioning device. Alright. Now, I'm going to take some of the lubrication and place it on the tubing. I'm going to enter the tube in one of the nares. And I'm not going to provide suction on its way in. I'm going to go in as far until I meet resistance or I hear a cough. And then I'm going to intermittently press this button to provide the suction. And when I move out, I'm going to move out in a swirling motion. I'm going to take about a minute in between each suction and only do a maximum of 2 suctions at a time. In between, I'm going to assess my patient for their oxygen needs and if they need another suction. In this case, the patient doesn't need suction. I'm going to remove the suctioning tubing from the device. I'm going to discard that. I'm going to remove my gloves. Discard those, my mask, and my eyewear. And then I'm going to perform hand hygiene. After each suction, it's important to rinse the tubing with normal saline. Alright. Then I'm going to don more gloves. And I'm going to gather all the items used here, and I'm going to throw them away, including the waterproof pad that was placed on the patient's chest. I'm going to document